Everyone, we're giving a couple of minutes for some participants to join, so we should be starting in 1 minute or two. Thanks for your patience. So good afternoon, everyone. Let me welcome you all again to this webinar in the series of Healthcare Technology Management in the Caribbean. My name is Begoña Sagastri. I'm a consultant for the Medicines and Other Health Technologies unit at the Pajo Sub-Regional Office for the Caribbean, and I will be moderating this session today. To start this session, we are having a very dear friend of the Caribbean to give us some welcome remarks. You all know him, it's Alexander Legremer. Please, Alexander, over to you to give us welcome remarks.
Thank you very much, Begoña, and I would like to say good afternoon for all our friends in the Caribbean. This is, as Begoña mentioned, is our third webinar in this series. So we are very glad that we can move forward with this project. Therefore, it's very important, a priority. We had already 2 webinars. In the total number of participants, I'm looking here, we have around 200 and more than 220 participants in the first two editions of the webinars. The first one on integrated approach to health technologies, regulation, health technology assessment, and health technology management, when we have 18 countries participating. The second one on showing the value of healthcare technology management, with 14 countries represented, and as I mentioned, a total number of, in fact, more than 230 participants. So just to remind you all that both webinars can be accessed through the Pajo YouTube TV channel, and the links will be shared in our chat. Please look at those links, and of course, this webinar today also will be available in our YouTube channel. The following webinar will take place on October the 22nd. So this is a tentative date, so we'll be confirming this as soon as possible, but please reserve this date in your calendar, save this date, October 22nd, for the 4th webinars of this series. Besides the webinars, we have been organizing workshops with some countries that have demonstrate interest. So we have a first workshop with Trinidad and Tobago, also with Suriname, and we are planning the following ones with Belize and Guyana. And so we are very happy with this project. We're very happy with this collaboration with Professor Toby Clark and the University of Vermont. As you know, our WHO Pajo Collaborating Center on Health Technology Management, and also with all supports from my colleagues at country offices, and a special thanks, as always, to my colleague Begoña Sagastri, and his continued support, and also for a brilliant moderation on this webinar series. And of course, other colleagues, Francisco Cacavo, and my other colleagues at the MT unit in HSS department, have been a great support. I would not mention all colleagues because it would be unfair, but Francisco has been doing a fantastic job, and also Abraham for continued support. So thank you very much for your participation. We already have 40 participants in the room, so ready to start, and I will pass the floor again to our moderator, Begoña. Back to you, Begoña. Thank you very much.
On the contrary, thank you, Alexander, very much for this. You can see right now in your screen the agenda. We're basically following the same structure as in previous webinars, and we'd like to start with this interactive exercise that this will be led by Gabriela Jimenez. And then we'll end up having a few minutes with Francisco to discuss again the community of practice. We'll have afterwards our presentation by Toby Clark, and then we'll have our session of questions and answers. Please do remember that you can put all your questions in the chat or in the questions and answers section that you will see at the bottom of your screen here in Zoom. Really, we appreciate all of your questions. They are the center and the motor for this webinar, so please do not be shy and share any concerns, thoughts that you may have after this presentation. So let's get this webinar started. So Gabriela, over to you so that we can start with our usual Slido session.
Thank you very much, Begoña. I will start sharing my screen.
And my thanks to Gabriela as well. As I said, we always forget, but thank you, Gabriela, for your support as well. Thank you.
No problem. Thank you, Alexandre. So thank you very much, everybody. I would like to ask you, if possible, to open your phone and your or your website or your web browser, and then join at slido.com, and then start with the hashtag HTMCaribbean3. So yeah, we would like to know in which country are you located, so we can start this audience characterization. Belize, Bahamas. Yeah, we will give a couple of minutes, then you can be into the platform. Yeah, it's really easy. Maybe you can, with your phone, start just take a picture of the QR code. Trinidad and Tobago. So we're still having a lot of participation. Thank you very much from Trinidad and Tobago. Suriname, Belize again. Yeah. Yeah, how many participants do we have in this session? 10 already. 10 responses. Belize as well. Jamaica. Mm, 11. Okay, so we're still start having more participants on board. 13. So Trinidad and Tobago, it's the main country from where participants are coming from during this webinar. Yeah, so then I will pass then to the next question. 14 participants. Then you can still going to the you can still accessing, then you can participate into this poll, the audience characterization, and then you will start having some questions about which institution are you currently working on, and then as well other questions about your background and the background about the background about health technology management that you have. So yes, please go ahead and start this small questionnaire. We will appreciate it a lot. So then we can have this knowledge about who you are, who is behind the screen. Thank you very much. So we have already 8 responses. If you have any doubt or question about how to access Slido, please put it in the chat so we can just guide you how this could go on. Okay, so we have 12 participants that already completed the poll. 14. And the majority of the participants for the moment are coming from Bajo, WHO, and other participants from hospitals at 20% or from the Ministry of Health. If you choose other, please don't hesitate to put from which institution are you coming from in the chat. We would like to know it. Will be very valuable. And then 7% from academic institution. Okay. Okay. We have 16 now.
Some participants are sending information via through the chat. I think it's they are having problems with accessing the app. So we can see here, for example, Barbados, Minister of Health, Grenada, hospital in Grenada. So it's good to look at the chat as well.
Yeah, thank you, Alex.
Trinidad and Tobago, Ministry of Health, Paul Taylor, thank you. So yeah, if you cannot access the app, please include information in the chat so we can. So we know that some people cannot access the app for some reason, or they don't have the cell phone right now. So we can capture the information. Thank you.
Thank you, Alexandre. Exactly. So yeah, we have 17 submissions already, and the majority is coming from in Slido from Copajo, then other institutions, hospital, Ministry of Health, and last but not least, academic institution. About what is your background, educational background? They say other. So please let us know which is the other background. And then we have 22% of biomedical engineers. Then other part of the audience coming from the management and administrative field. Then paramedic, nurse, nursing, physician. And then 11% of biomedical equipment technicians. And other engineering or pharmacist, biochemistry, we don't have so much participation. So yeah, thank you very much. Next question. Let me change to the next question. What is your background knowledge in terms of health technology management? Then we have 19 responses, and it's 53% intermediate. So yeah, we're very glad to know that we have some background knowledge about this topic. And the basic 32, advanced 16, and then we're having some variation. 20 participants already on board into this exercise. Thank you very much. And have you participated in previous webinars? And yeah, that's really good to know. We have 62% that have participated in both previous webinars, 29 no participation, and then just in one webinar 5%, and just in the webinar 2 5%. So yeah, very glad to know that we have participants coming again to these sessions that are very interesting about health technology management. So yeah, thanks for this for participating in this exercise. We will have a question at the end of the presentation, so don't close your Slido, and if you can still participate in this audience characterization if you didn't manage before. Over to you, Begoña. Thank you.
Thank you very much, Gabriela. It is always very useful to know who's here in the room with us. So thanks everyone for participating in the Slido, and also those who put your comments on the chat. So now, following our agenda, I would like to give the floor to Francisco Cacabo, who will make again a short presentation about the health technology management community of practice, but it won't be precisely the same presentation. We're going to see what has been happening in the past couple of weeks. So Francisco, over to you.
Thank you very much, Begoña. Just a second, please let me know if you are seeing my screen now.
We are seeing it, but in the presentation, presenter view. So not sure if you might be able to switch it.
Just a second, it's swapping displays. There.
There it is.
Okay. So as Begoña was saying, I want to make a brief presentation about the regional platform of the community of practice. So since many of you were already on the previous webinars, I'll try to be brief. So we are about to launch this community of practice, healthcare technology planning and management community of practice for the Caribbean countries. What is it? It's a virtual space. It's hosted in Price. I will now explain what Price is, and it's coordinated by Professor Toby Clark. Most of you already know him, but for those who don't, Professor Toby Clark from University of Vermont, our collaborating center for health technology planning and management, will be giving the coming presentation. And it's a forum for the discussion of healthcare technology planning and management problems, practices, and for the exchange of information. Here on this image, it says snapshot of how does it look and its different sections, and we will see it in a bit more detail. And this is a price. You can access price at this address, web address, price.paho.org is the regional platform on access and innovation for health technologies. And it has different sections. It's not just for our community of practice. It has several community of practice of different topics. And you can also access, I'm sorry, it's in Spanish here, but it's also in English and Portuguese. You can pick your language here, and you can access latest news on medical devices, on medicines, and on every health technology and innovation as well. Okay, so this is the snapshot we were seeing before, but with zoom on its different parts. You can go to the bar there on the left, and you will be able to access, well, here on the About section, you will find a description of what our community of practice is about. On the members section, you will find who are members of the community of practice, and you will be able to contact them directly, send them a message if you need some information, or from some other member of the community, from another Ministry of Health, from another country. It's very practical and useful. There's an agenda of the different events we have here. Okay, now this is a bit outdated, but I mean, the presentation, the webinars, for example, are there, and different events. And there's a library with very interesting and valuable material. These are some of the things we have. So if you want to join, sorry, I will go up a bit on the back here. Up there it says price login. To join, you will first need to make a user on the platform, and then you will be able to join the community of practice. So to join the community of practice and the platform, you need an invitation. We are glad to send that invitation to you. So those that are interested, if you haven't registered yet, those that have, don't worry, we will send you the email. We haven't sent the emails yet, but please, you can scan this code, or in the chat, Jasmine will be putting the link. Thanks, Jasmine, for that. And you will be receiving an invitation to join. So until now, since the first webinar, we've received 53 registrations, which is quite a number. And well, many of them were, you can see here, the distribution of countries from each, participants from each country. And it really correlates with the representation here on the webinar, on the past webinars. 16 were from Trinidad and Tobago. Also, many were from Belize. And well, then it was more homogeneous. Jamaica and Haiti, also 3, St. Lucia. But please, all participants are welcome to join, and then it will be a interesting and fruitful experience. That's it. The word back to you, Begoña.
Thank you very much, Francisco. Please, everyone, do register. You're not going to regret it. We're really, even you can tell other of your colleagues that may have not been able to participate in the webinars to join. It will be useful. We will be sharing important information through this community of practice. So we do encourage you and your colleagues to register. And now for our main event, we're going to introduce our keynote speaker, Professor Toby Clark. Again, for those of you who have not been able to join us in our past 2 sessions, let me give a brief introduction of Professor Clark. He is the director of the PAHO WHO Collaborating Center for Health Technology Management at the Technical Services Partnership, University of Vermont, where he also serves as an engineering supervisor. He has also been on the faculty of Electrical and Biomedical Engineering and Biomedical and Health Sciences departments, where he has taught medical instrumentation and clinical engineering courses. Toby has worked in the biomedical engineering area for 49 years. He's a very, very good friend of PAHO and for many countries in the Caribbean that he has supported. So again, Professor Clark, thanks so much for being with us today. Over to you for the presentation.
Thank you very much, Begonia. Especially happy to be here with yourself and appreciate your introduction. Alexandre and his team from PAHO, and especially all of you who are on this presentation. Appreciate you taking your time to be part of this learning experience. So I will just share my screen here. Just give me a minute. Okay, I hope everyone can see the screen. We've been focusing on healthcare technology management, and today we're going to address the area of capacity building with a specific focus on medical equipment maintenance, support, and management. This has been a reoccurring area of interest by all in the Caribbean and other parts of the globe. It's an area where we can make a difference as biomedical clinical engineers involved in healthcare technology management, both from the perspective of administrative actions and also, of course, actions to repair equipment, to ensure the quality of equipment, ensure that the appropriate equipment is purchased. So we'll start, first of all, talking about capacity building, and the main focus of this talk will be on capacity building. So there's various ways that we can train and deliver education. Traditional ways are more involved in classroom activities, laboratories, publications, textbooks. These types of educational activities have been around for many, many years, and they continue very strongly. Internships are incredibly valuable, in my opinion. We've been lucky enough to have almost 50 international interns from the Americas come to University of Vermont for training, and I think it's added a lot of value to the countries that they serve now. Conferences, there's many conferences that occur, US and globally. Certainly PAHO has put on a number of conferences related to technology assessment and regulations and other activities. Online and virtual has really taken over during the pandemic for many educational and training activities. People were trying to figure out how to simulate the advantages of a live classroom using virtual technologies. So webinars, platform-based learning, such as the PAHO Virtual Campus, even smartphone apps are used. Hybrid courses are another method. I know our university has very active in terms of hybrid courses where you have some in the class and some of the activities are virtual. A flipped classroom is kind of a hybrid approach where the students actually end up learning everything virtually, all the book reading, etc., content. Then they come to class and they do their assignments there. So it's just opposite of what has been done in the past. Lastly, virtual and augmented reality is another way that is a wave of the future to be able to do hands-on training. So the traditional live classroom, as you can see here, this was a conference that Alexander Lumgruber, you can see him teaching a class. This was a Washington, DC class in 2019 on healthcare technology management. It's also, classrooms, of course, are used for formal education. Has many advantages: direct questioning, excellent networking between students during the class and outside of the class, and of course, human interaction. Laboratory courses where you have hands-on activities are really essential for maintenance training. It really fosters teamwork because usually there's a team that's working in that laboratory to learn. And this laboratory could actually be in a hospital if you have that capability. I did want to bring up I had written a chapter in the Clinical Engineering Handbook on distance learning and bring up the various programs around the country, around the globe that have formal engineering virtual educational programs. So you can see University of Connecticut, University of Vermont in the US, many universities in Europe, in Britain, Leeds, Glasgow, London, Greenwich. So there are a number of virtual programs that you can get, typically a master's degree, but also get other degrees or certificates using virtual training. So I'd encourage you, if you are able, the Clinical Engineering Handbook, which came out in 2019, is a valuable resource. For maintenance, medical equipment quality assurance is really a key aspect of preventive maintenance, ensuring that the technology is working correctly and is accurate and is safe. So several years ago, actually more than 10 years ago, we wrote a book on medical equipment quality assurance. This is inspection program development and procedures. So it's myself, Michael Lane, who's also co-director of the Collaborating Center, and Leah Francoeur, one of our top clinical engineers. So this, I believe, is available on the web in some locations. We'll be putting that on the platform if that's acceptable to PAHO. So internships, again, this is really an area, is an example from University of Vermont. We have an internship program we started in 2005, and we've had about 50 interns that have come through from the Americas. Basically, we want to get them up to speed, orientation, training, and especially mentoring the students so that they can have a career in clinical engineering, which, again, is also some places called biomedical engineering or health technology management. So we go through a training part of that program. Then we do multiple weeks. This is the half-year program, working in the hospital, doing quality assurance testing and maintenance, split with doing project work with our engineers. So you can see here, we have a University of Vermont student, Paige Hamilton, working with Vedisha Peru, who's one of our students from Trinidad and Tobago. And then Kanisha Charles, she was a recent student who did very well in the internship program and is in the Caribbean now. So virtual training, as I mentioned, this is really the area that is really taking off in terms of education, training, workshops, etc. So Alexandre talked about the webinar series that we're offering here for the Caribbean. There's many, many webinars that take place from other organizations, but we're trying to put all the materials that are part of these webinars onto the community of practice that Francisco talked about. We want to have that to be a resource for all of you. So it's very important to sign up for the community of practice. There's also webinars through the REDETSA Health Technology Assessment Group and other ongoing activities. The World Health Organization also has a number of virtual training that they are working on. Probably the most significant, something I've been working on now for actually over a year, is to develop about 35 professional videos in the area of COVID-19 respiratory equipment training. So I was going to quickly show that training here. So I'll just get out of this for a minute and hopefully we'll see this training. I hope that you'll be able to hear this. It is set so that the audio should come through, and I was just going to show this to you. It's this training, I believe, is on oxygen concentrators, but it's representative of the series of trainings that we're developing. And it goes through the various steps of the life cycle. So we'll just look at a little bit of this because we don't really have time to go through the whole thing. I can't give you a link to it because this training is still in development. Soon, I hope, definitely this year, it will be available to everyone.
Good, and that it stays in good. Planned preventive maintenance oxygen concentrator.
So you can see that there's a number of steps here that we go through in terms of all these health technologies. Selecting the right equipment is the first step. The second step is getting the medical equipment ready. So that's the acceptance testing, the clinical use of the equipment, decontamination, corrective maintenance, which is repair, preventive maintenance, and finally decommissioning. So we'll just watch a little bit more of this and then go back to the presentation.
Planned preventive maintenance, or PM, is essential to ensure equipment is safe and performing as it should, and that it stays in good condition for its lifespan. It involves inspecting the inside and outside of the equipment, testing the equipment for electrical safety, performing specific PM tasks on the equipment, such as changing parts, and verifying the performance of the equipment. Preventive maintenance is typically done by clinical or biomedical technicians, technologists, or engineers, but may be done by another technical or clinical professional at your healthcare facility if they have had appropriate training and have the right competencies. The frequency of planned preventive maintenance varies by the environment of use and the manufacturer's recommendations. More frequent preventive maintenance is needed in hot, humid, and/or dusty environments. At a minimum, preventive maintenance should be performed annually or every 5,000 hours of oxygen concentrator use, whichever is sooner. In an extremely dusty or humid environment, minor preventive maintenance to clean the oxygen concentrator and change its filters should happen every 3 to 6 months. If an oxygen concentrator is due for preventive maintenance but is being used on a patient, the PM can be delayed until it is available, or the unit can be replaced by another concentrator, but the scheduled preventive maintenance should never be canceled outright. This video will cover common preventive maintenance tasks for any oxygen concentrator. Read through the service manual for your model thoroughly and
Okay, I just wanted to give a snapshot of this video. It goes through all the various procedures that you would follow to go through for preventive maintenance. So it's something that is very valuable, and I looking forward to having that available to all of you through the WHO. Okay, just trying to find my space again. Here we are. Okay, so that's something that's going to be a valuable resource, those 35 videos that go through those various steps in the life cycle for the priority medical equipment related to COVID. Other virtual training from International Federation of Medical and Biological Engineering, the CED division. In the US, there's a number of groups: American College of Clinical Engineering, Association for Advancement of Medical Instrumentation, ECRI, although they usually cost money, and MD Publishing is another. So PAHO has a virtual campus for public health courses, and I know that many of you have taken those courses. Back in 2014, we had more of a course that covered maintenance specifically. This would be the hands-on aspect of the maintenance done virtually. And of course, now we have the Health Technology Planning and Management course that's run, this would be the 4th time that we're running it, this time for Haiti. Other courses, virtual course on assessment and many other areas. The REDETSA has health technology assessment courses on there. Manufacturers have really stepped up in terms of offering training for maintenance. And the Ventilator Training Alliance is one example. Other companies, Fluke Biomedical, Philips, etc., and non-governmental organizations, PATH International, Assist International, Engineering World Health, etc. So hopefully we'll be able to provide links to those areas on the community of practice. But before I do that, I think I have another minute that I'm just going to bring up, go back to the internet here. And oh boy. Just wanted to show, again, this is the Ventilator Training Alliance, and this is a bunch of manufacturers, some of the very important ones who have released training for maintenance on this website, Ventilator Training Alliance, vta.allegro.com. So that's a good resource. Webinars from organizations such as Clinical Foundations. Here's one on high-flow nasal cannula therapy. And there's publications on the same. In the US, there's something called Webinar Wednesday, where there's webinars on various topics having to do with maintenance primarily. This one's mammography quality assurance. So I just wanted to bring that up as those examples of virtual training that are available. So let's go on to do a little training here. And first of all, looking at the area of planning for maintenance. It leads to positive results, decreased expenses, increased safety, increased revenue in the US, you probably say that, but it's really the availability of the equipment and enhanced patient care. In terms of maintenance expenses, what's the breakdown? Well, imaging is a big area for expense for medical equipment. If you have a CT scanner in your facility, you know that that's probably a $100,000 contract US. Other areas also are part of this piece of the pie, clinical lab especially. What type of payment options do you have? So this would be, how do you pay for this? Well, manufacturer service contract is the first thing that comes to mind. And there's various options for service. You can have full service, you can have parts only, you can have labor only. The health system itself, your clinical biomedical HTM department, that is a good place to get service from. It's rapid and it also is the lowest cost. Independent service organizations, another option. Maintenance insurance, I'm not sure how prevalent that is in the Caribbean. Our department has a maintenance insurance program primarily suited towards the expensive equipment repairs. Might be something to think of in terms of combined Caribbean program. Plans, various plans, you can pay by contract, you can pay by the hour, you can develop lease plans. So again, these service delivery options, we just covered these, the service contract, third party, OEM, in-house support, which is the biomedical department, time and materials, and insurance. So this just is a chart that shows the various, these three types, manufacturers service, independent service organization, and healthcare-based biomedical department service. In general, the response time for the biomedical department is the best, and it depends on where you are and what the logistics are as far as the original equipment manufacturer goes. Sometimes it can be days or weeks. Expertise, well, the manufacturers, they definitely have excellent expertise. For the biomedical department, it may be more variable. Same with the experience. Spare parts are always a problem, and particularly for the biomedical departments. And I've heard stories in the Caribbean where there may be very long delays in getting biomedical parts. There's a lot of reasons why either the distributors or the companies themselves won't release those parts. So sometimes they're difficult to get. Of course, the original equipment manufacturer, they have excellent access to parts. Training, this is something you have some control over. It's somewhat variable within the biomedical departments, but you can get training from the manufacturer or from the distributor. Price, the lowest price is definitely the biomedical department. The highest price is typically the manufacturer. So the steps in evaluating what you need in terms of maintenance coverage. First of all, what do you need to cover? If it's something that is only used 8 o'clock in the morning till 3 o'clock in the afternoon, you don't need to cover it 24/7. You only need to cover it 8 o'clock to 3, and you would have your service come in after hours to take care of it. Get proposals and determine which proposal matches your needs for maintenance. Drill those down, continue your negotiations to get a good coverage proposal that is inexpensive for your needs. And then compare and evaluate, say 2 or 3 of your top possibilities. Service contract, again, imaging and lab is typically the area of the most contracts. There's a lot of proprietary technology in those areas. Whereas biomedical equipment, which would be your infusion pumps and things of that nature, it's more likely that you'll have access to parts and also to documentation. But sometimes you have to consider a service contract because you don't have the expertise in-house to do that. You don't have the resources. Many times there'll be the head of the department may say, I really need manufacturer service. Very common with, say, imaging department. If support is included, if you lease equipment, you may not have to worry about maintenance. It will be covered by that lease agreement. Or sometimes it's more expensive to do in-house service because you have a big training cost and then the person gets hired by the company down the road. Independent service organizations, here's just a list of things to investigate if you're considering those, the resources they have, the experience, and their reputation. So maintenance management must start at the, really before the device is purchased. That's when you have the leverage. So the key question first to ask is, can you support the device? But if the vendor thinks that, the sale depends on having a good service agreement, whether that involves the biomedical department or not, they're going to go and they're going to go the final yard to basically implement that. And if you can't get good agreement, get the materials that you need to understand what's going on at the pre-purchase, what about down the road? But of course, plan for future alternatives. So as part of any request for proposal, documentation, technical support information, remote support information, at least cost for technical training and proprietary test equipment. Preferably include that if you're going to be servicing the equipment. Centralized support is the best for expense documentation, quality assessment, and regulatory management. Contract terms and conditions. If you do have a contract, you should be monitoring the vendor service, documentation, enforce the response times, ensure that you can cancel the contract, and the IT protocols so everything's secure. So in summary, looks like I'm a little over, I'm sorry. Delivery options, You know, there's many delivery options for capacity building. Virtual training now is really a lot better than it had been in the past, and POW and WHO are key areas for that. Engineering education seems to be more common than technical training though. Virtual maintenance training options, they've increased, particularly for those devices that fight against the pandemic, and I showed some examples. But still, you need hands-on training. It's essential for maintenance. So mentoring and internship programs are important. Lastly, maintenance planning. We talked about maintenance planning, and it all starts at the acquisition phase, where first of all, you have to decide if you can support that. So capacity building is really essential to realize the value of in-country maintenance support. So this kind of went through these two topics, and I look forward to questions. Thank you.
Thank you very much, Professor Clark. Please do remember that you can use the chat and the question and answer sections to ask any questions or comments for Professor Clark. And before getting to that section, Gabriela is going to do a quick Slido poll again. So Gabriela, over to you.
Thank you, Begoña. Yes, it's just this question about, and it's mainly a triggering question for you, considering this topic, like what are the roadblocks to improving the capacity and competence in maintenance support and management. So we will appreciate your opinion, and it's with the same dynamic of joining at slido.com, hashtag HTMCaribbean3. So maybe you can share with us these roadblocks to improving the capacity. And yes, please start, and then we will start the discussion during this remaining time. Thank you. So yeah, maybe I can leave it open and pass it over to Toby, so then we can start the discussion. It's okay.
Perfect. Thanks, Gabriela. Toby, one of the questions that we're getting is, what are the educational requirements for staff providing maintenance service or management? Like, is there any specific educational background that is needed?
Generally, technical training is very valuable. It doesn't necessarily have to be specific in biomedical or medical equipment. So, for instance, if your country doesn't have, say, a biomedical technology program, but has a technical training program in general, electrical, mechanical, etc., to start an internship with that college, university, to get those people out into the hospital and kind of work with them, mentor them in the area of medical equipment. So in the US, that's generally a 2-year program, but it can vary, the technical training. Excuse me. Over.
Oh, sorry. Thank you for that. Alexander, we have a question that's related to the virtual courses that we have in the campus. First of all, they're asking when will the next health technology management course on the virtual campus would be offered, and also if there's a version in French for Haiti.
Thank you for the questions. Yes, there is we just launched a French version for especially for the project with Haiti that we are developing. And we just started this week, in fact, a course. For the first time, we have the French version for the health technology management course in the PAHO virtual campus. So I'm very happy to do this. As I think everybody knows, we have previous editions, several editions in English and in Spanish. But we have decided to prioritize the French version this year. And so this is the first week of the course, and we have around 45, if I'm not mistaken, 45 participants in all regions of Haiti. So Our plan is to also translate the Introduction to Biomedical Technology course in French as our next plan for next year. So we are starting the translation right now. Regarding the editions in Spanish and English, and for the English-speaking countries here, we are planning to do this next year for sure. We haven't decided about the dates. I would like to do this first semester, but I will inform you all through Begonia in the upcoming months. As soon as we figure out our budget for the next biennial, we're working on that, so try to secure funds. But as soon as we can confirm, I will let you know about the dates. But for sure, we are going to have an English version again next year. Thank you.
Thanks for that, Alexander. Professor Clark, another question for you. We're thinking about what are some of the main roadblocks that, from your experience, countries usually face for providing quality training? You're on mute, Professor Clark.
I think that some countries can't justify an educational program in biomedical technology. Those that can do have programs, and that's definitely an advantage. In terms of training itself, the biggest roadblock, I think, is basically including training prior to the time of purchase, and in the purchase agreement, that training will be provided by the manufacturer, distributor, whoever is selling that equipment to you. They have an arrangement for training initially and ongoing. So I think the biggest roadblock is really at the time of purchase, that if you don't get the training included with the purchase agreement, it's going to be very difficult down the road to have that included.
Yes, I mean, this is very much in line with what we're seeing right now in the screen, that the fact that service training is not usually included. Is there any recommendation that you could give the countries regarding how to ask this from the vendors when they're in the process of procurement? Any tips, any way to do this and put this negotiation forward?
Well, I think, one thing is to try to understand what the needs are of the manufacturer or distributor. They want to sell equipment, obviously. If there's something that you can bring out that will help them understand that you're the customer, that you are buying the equipment, that if this works out now, in the future, you'll continue to buy that equipment from the vendor. Another thing is just to say, it's difficult to travel to our country. We will take care of the technology and work out some type of arrangement where even during the warranty period that the biomedical department is supporting that technology and getting the training, and in some cases getting reimbursed for that. Over.
Thanks for that, Professor Clark. The team at PAHO, I've seen in the chat that there are questions being asked regarding how to access these sessions. I think this was answered, but maybe not for everyone. And also, I'm not sure if we can post again the link for the community of practice. A couple of people have reached out because they joined after the link was shared, so it's no longer available in the chat. So if we could put that again, we would really appreciate it. And finally, Professor Clark, the last question that I'm getting here has to do with how do you build capacity for medical equipment maintenance support and also management staff?
Well, in the past, traditionally, people who are very good technically get promoted to management. That's not always a good thing, but most of the time it is, because they know the field. But for management, it's a completely different mindset. So additional training on getting them working with your staff, what they need in terms of resources is very important. In terms of management itself, understanding the contracts, understanding the business side of healthcare is very important. Our managers go through, even if they're the best technician in the world, go through a business type training course to be able to take on the management aspect.
Here I'm seeing a question from Paul Taylor regarding, well, not a question, a comment that I think is really relevant, that sometimes it is the economy of scale. The cost to train 1 or 2 engineers can be prohibited as opposed to extend warranted service contract cost offered by the distributor. The training might be for 1 item of equipment. Not sure if you have any thoughts around this, Professor Clark, but I think it is really relevant about this thing of the economies of scale and how to really get access to training.
Yeah, and I think this is a great forum for that, because to do that you need the leverage, and you need to somehow create a network within the Caribbean where you can work together, start a network, and address these areas, particularly capacity building, the purchase process. All those areas would really benefit if you could all get together and get into a network and be able to. I know there's something out there, CARICOM, I've heard, but I know that's really what you need, is that leverage to be able to do that. Because if it's just a single piece of equipment, a single person, that's almost going to be impossible to have somebody come to your country and train.
And finally, I know we're right now over time, but I thought this is very interesting comment because it links to the previous webinar, that what happens when leadership does not engage, that the leadership that is engaging in the contracts is not covering training and is not sensitizing this subject. So if there are any recommendations on how to put this forward internally?
Could you repeat that, please? I'm sorry, I was reading a comment.
No, they're very interesting comments right now in the chat. It was mentioned before that sometimes the leadership or the people that are negotiating the contracts are not really aware of business of training and are not sensitized around this. So is there a way or any technique that maybe this can be done internally?
Yeah, well, I think the last webinar we covered some techniques that could be utilized. You certainly don't want to be in the hospital that gets sued for multi-million dollars, as was one example from the US. So, training is important and should be able to justify the importance of quality.
So we invite you all to take a look. If you were not able to participate in the previous webinar, Francisco, I believe, already shared in the chat the link where you can find this session in our YouTube channel. So unfortunately, as usual, these sessions run too short, but it is time for us to say goodbye today. We will be having our next session. We believe is going to be October the 22nd. So please save the date. You will be receiving communication on this. And Alexander, would you like to give some closing remarks?
Well, I just say thank you, Begonia. Thank you, Professor Clark, all the team here that work very hard to organize this series. Francisco, Gabriela, Jasmine, Abraham, and of course all the participants. I mentioned at the beginning the number of participants we have been reaching, and I think it's very impressive. It's true that we have in the first workshop an incredible number of, I think, almost 200 participants. In the second one, around 75 participants. Today we have around 50, 55 participants. If we could give a more pessimistic interpretation and say that, oh, we are dropping the level of interest, but I prefer to give a more optimistic interpretation of this, that this group is the group that really had interest in the engagement and in this topic and give priority for this topic. So maybe the first group was, okay, let's see this, but after 3 webinars, And we can see that the majority of the participants today have attended the previous 2 webinars. So it really shows us that we have around 40 to 50 people in the Caribbean that are very interested in health technology management. So this gives us a motivation to move forward, to keep this project, which is right now we have the funds to by the end of the year, but I'm sure we are going to secure funds to keep this project for the following years, because as Begonia has mentioned several times in our conversation, this is a priority for the Caribbean countries. We can see from the comments, we can see from the level of participation, the questions and the interest. So we are very happy with the results. As I mentioned, we are saving the date of October 22nd for the 4th webinar. We will continue organizing a national virtual workshops, and this collaboration, we are going to move forward for sure. So thank you very much. We are also very interested, very happy with the registration in the community practice. Right now, I think we are ready to really start with the exchange of information. And so I invite you all. So for those who did not yet register in the community press, please do so, because this is going to be our tool for information sharing, for moving forward with the strengthening of health technology management in Caribbean. So thank you very much again for your engagement and your participation, and Begonia again for this brilliant moderator. The only problem of being so brilliant in moderation that we're going to invite you for all the webinars in the upcoming years, but I think that's the problem of being so good. Thank you very much.
Very excited. It's a pleasure. And just to finish up, Alexander, I also want to thank the participants, because it is true, in the past couple of weeks, we have seen very important surges of COVID-19 in the region. So I think that it's also being reflected in the participation. So thanks all of you that are participating today. We know that several of you are going through very difficult times in your country. So thanks for giving the time to talk about health technology assessment, and we're here to continue supporting.
Very good words. Stay safe, everybody. Bye-bye.
Bye.